Hello and welcome. I'm really pleased to share with you this interview with Dr. Robert Schleip. He's worked for many years as a hands-on manual therapist and became so interested in a type of connective tissue in your body called fascia that he ended up entering into research to study it. Robert shares some of the intriguing findings from his research, including how different types of stress can be stored in our bodies. He and other researchers are declaring the connective tissue in your body, your fascia, our richest sensory organ of all. He also explains how breathing exercises, including humming, can powerfully affect our physiology through the release of nitric oxide. Robert's a really great guy. I hope you enjoy this interview, and please remember to subscribe to the Inner Sense YouTube channel for more of this type of information. Thank you very much. Maybe we can start by hearing a little bit about your background and how you've ended up working as a researcher.
Well, originally I studied psychology because I was a child of the human movement potential. I was influenced by primal scream and Gestalt therapy and the hippie movement. I was a late hippie movement influenced young student. But having come from psychology, I moved very early on into what we called body therapy at that time. And that led me to the Rolfing method, which at that time when I studied it, which were the mid-70s of the last century, it was more oriented as a means to open the body in order to have a better access to emotional and spiritual experiences. So I've been a Rolfing practitioner, also a Rolfing teacher now for several decades. I also studied the Feldenkrais method. And I used to work with the body, not only to get the posture better, but also to change the experience, the attitude, the thinking, the inner feeling, even the identity of the person who is influenced by it. And having practiced body work for a long time, I didn't feel satisfied with the scientific explanations that we use to convince our students in the Rolfing classes. They were usually satisfied, but I as a teacher was not satisfied. And that's why I finally asked for a sabbatical, where I said I want to stop teaching for a year in order to be able to check the scientific foundations a bit more thoroughly. And that became a very fruitful adventure in my life, that I had a whole year to go to library and to interview scientists to find out more what is happening under my hands as a Rolfing practitioner. And then this sabbatical year, it was so exciting for me that I extended it another year and then another year, and I'm still in the sabbatical. And my Rolfing and Feldenkrais colleagues, they say, Robert, we miss you, but what you're doing is also valuable for us, and please continue. So now I see myself as a missionary, reporting what I have learned in the last 10, 15 years by being among laboratory scientists and translating their thinking, their questions, their findings into the world that I still feel very much connected, which is as soon as I put my hands on a client and feel connected with them again. So I see myself as a messenger, as a missionary between scientific laboratory research and hands-on bodywork.
What a wonderful space to be in, to be able to connect and link all of those different languages and experiences together. So I know you are, you've done a lot of work on the connective tissue called fascia. So can you explain in your own way what fascia is and how it's led to you understanding the fascial network as the biggest sensory organ in our body?
Well, you could say to a normal layperson who is not polluted by medical terminology, fascia is what we used to call connective tissue before, particularly the soft fibrous connective tissue. So if you eat meat, it is the milky envelope around it. as a collagenous membranous network. And in conventional anatomy, they only called these membranous layers, they called them proper fascia. But the research in the last few years has shown that actually it's not just individual pieces at isolated areas of the body where this network is expressed. It's all over. It envelopes not only some muscles, it envelopes the whole body, every organ, even on the inside of the muscles. You do have these envelopes within envelopes within envelopes. So the modern definition of fascia is a collagenous connective tissue network that penetrates and surrounds our whole body. And so you can say it's not only, so we don't have 200 pieces of fascia like we have 200 bones or 500 muscles, but you have one body-wide fascial network. And I didn't have that insight myself. I got it from the founder of the Rolfing method, from Dr. Ida Rolf. She put our attention into this fibrous collagenous connective tissue that conventional anatomy had always known, but they considered it rather secondary. They treated it like you and I treat the wrapping of a Christmas present. You look at it, you put it at the side, and then the computer or whatever the present is works perfectly without the wrapping. And that was the assumption in conventional anatomy for several hundred years. And now we have shown the muscle without the wrapping works completely different than with the wrapping. The same for the heart, the same for almost every organ. So what has been happening in fascia research, and I was very glad to be there at the right time to contribute my little piece, is that we are putting the envelope back and studying the body as it does in a normal person. Because when you and I move, our muscles transmit a large portion of their force, not from tendon into the skeleton, but into these fascial membranes. And then the gluteus maximus is influencing the arch of the foot. And it has an influence all the way up to the neck, etc. So this is a modern perspective, which I'm very much excited about.
Wonderful. So within that network of membranes surrounding everything, I've heard you talk about the different types of nerve endings and sensors and receptors. Can you say a little bit about the sensory component of fascia?
So when we started with fascia research, we looked at the force transmissionology, so at the biomechanics, and we had enough insights to be inspired about it. But now in recent years, we are looking more at the sensory capacity of this body-wide network. And it was known before that there are sensory receptors, free nerve endings that are often associated with myofascial pain, for example, but also temperature sensation. And also larger nerve endings like the muscle spindles, like the Golgi receptors, that are related to locomotion and the way how our body relates to the biomechanical or gravitational environment to the outside. And so we found some nerve endings there. Other groups had also found them. And we started to say fascia is a sensory organ. And when we used that term, people said, well, that you found a few nerve endings is exciting, I know, but maybe it's a little bit premature to say it's a sensory organ. But in the last year, we were able to make a very thorough calculation on the total number of sensory nerve endings in what we call the body-wide fascial net. So that includes the loose connective tissue under the skin. It includes the fascial tissues around the viscera, not just the muscles. And we came to the prediction that it's probably 250 million sensory nerve endings in the body-wide fascial net. And then it's very, very clear this is not just a tissue that is innervated, it's a sensory organ. Not only that, it is our richest sensory organ of all. So even the skin has less, even the sense of seeing, which most people thought is the primary sense in Homo sapiens. So for the dog, it's smelling, but for humans, we assumed that our sense of seeing overrides and is the most refined sense that we have. And if there is any conflict with the other senses, seeing usually takes over. But now we discover, yes, seeing is very rich. It's very potent in Homo sapiens, but our body-wide fascial net is even richer in terms of sensory refinement. And then we have to study, how do we stimulate these receptors? And most of them are stretch receptors. And that makes experiences like yoga so pleasant, because it stimulates, it nurtures your richest sensory organ of all your sensory organs in your body. And I feel that is a very profound discovery.
So exciting to think that signals coming from inside our body, around our organs, deep inside our body, are in some way feeding information up to the brain. And every time we move, or every time the organ moves, the heart is pumping, or the guts are moving, then our brain is being told about that. So when it comes, you mentioned the skin, the difference between the nerve endings in the skin and the fascia. When it comes to fascia, how do you distinguish between its roles maybe in interoception, so internal feelings, versus proprioception, so coordinating movement? Is there any distinction you make, or are they the same?
Of course, everything is related, but it makes sense to try to distinguish which stimulations, which mindful attention practices, and also which nerve endings are primarily related to proprioception, in which you measure where your arm is in space and how many degrees your elbow is flexed and how much weight you have on your right foot or the left foot. So that would be proprioception. And also there are lots of free nerve endings. Interoception always comes from free nerve endings. And they are much more numerous than the encapsulated proprioceptive nerve endings in the fascial network. And then we can study, and that has been a recent focus of our research and attention. So what is fascia as an interoceptive sensory organ? Because in my clinical practice as a Ralph movement practitioner, as a Feldenkrais teacher, and also in my collaboration over the years with the Iyengar yoga teacher, I focused a lot in where are you in relationship to gravity and to the outer space and to biomechanics. And now we are learning from the psychological research happening on interoception, you have much more body signaling happening that is related to your physiological body condition. How warm is your leg? How alive are you? How hungry, how young, how old do you feel when you get up in the morning? How inspired are you when you sit with another person at dinner and they turn you on and you feel, wow, your aliveness bubbling up. So this bubbliness, the sense of tranquility, the sense of tiredness after a long hike, these are all interoceptive sensations. And interoception comes largely from the fascial network, but then from different free nerve endings and also from different regions. Usually it's more the connective tissue around the guts. So the enteric brain are free nerve endings that are in the visceral fascia. And that is, and then you do different yoga positions if you want to stimulate them. Then if you want to stretch your rectus abdominis and the rectus sheath as a fascial component around it. So I think it's very beneficial to examine what happens with fascia as a proprioceptive sensory organ. And then these extensional movements are very, very good. And what happens with fascia as an interoceptive sensory organ. And there you feel your heartbeat, you feel your belly, your digestion, and also a lot your temperature regulation. So if you take a cold shower or you talk with somebody or you do a meditation and you feel your fingers warming up, that is interoception. And you can train your mind to regulate your temperature regulation. via mindful practices, for example. And temperature regulation is related to the sympathetic nervous system, and that is the richest sensory nerve ending type. It's 40%, we just learned half a year ago, 40% of all nerve endings in fascia are sympathetic nerve endings. No other type has more, neither the muscle spindles, nor thermoreceptors, nor anything else. So the autonomic nervous system has the richest connection with the body-wide fascial net, and a lot of that has to do with fascia as a temperature regulating tissue, and that's partly, to a large extent, the superficial fascia, the subcutaneous connective tissue under the skin. And there you have a lot of this temperature regulation.
We can use movement and yoga to kind of give our organs a pleasant experience, a pleasant massage, and we can use our attention to regulate our temperature. And the fascia has a role in communicating and mediating all of those phenomena. So I'm aware from your past work as a sort of hands-on body worker, fascial release therapist, that you, under the work of Ida Rolf, you understand that people can store stress or discomfort in the body in different ways. What were the most insightful things you learned about when you were touching people's bodies with your work, learned about how people store stress and how that manifests in maybe posture or injuries?
I was influenced by a German phlebotomist, Professor Staubesand, and he motivated me to take that sabbatical year and do some laboratory research myself, because at the end of his career, he found sympathetic nerve endings in the fascia cruris, the dense fascia of the lower leg, together with contractile cells that looked like smooth muscle cells to him. And he came up with a very intriguing hypothesis that we have two systems to regulate tension in our body: the well-known musculoskeletal regulation of muscle tonus, so in which your voluntary brain can tell your muscle to get your shoulder up to protect yourself if somebody beats you. So in milliseconds, you can tighten your muscles, but you can also relax them in milliseconds. And that would be the normal neuromuscular coordination. But if you have smooth muscle cells, and if they are innervated, as he suspected, by the autonomic nervous system, then you may have a background tension regulation system in which your autonomic nervous system, and that is usually not so much directed in milliseconds by voluntary thinking. It's more your emotional attitude that goes into your autonomic nervous system. And that background attitude, whether you are under stress or whether you are in deep relaxation, would then influence not so much the skeletal muscle fibers, but the fascial envelopes around them. So he suspected that when we are under chronic stress for a long time, it's not our muscle fibers that are shortening and tightening, it's the collagenous white fascial connective tissue that are then stiffening over time. And I found that very intriguing, because that's what I often feel. Mm-hmm. So if I treat a client and they have an exam the same afternoon, I can realize that they are tight, but it's not so deep. But if they live in a work environment and at home also, where they have chronic stress since months, that feels very different when you touch them as a Rolfian practitioner. If they come to you every week, and you can feel the fascia getting drier, stiffer, they lose their elasticity. And so that was where my research has led me. And it took me 10 years finally to find out that Staubesand was right. So there is a connection from the sympathetic nervous system to fascial stiffness. And we clarified the pathways. One is through a cytokine called TGF, transforming growth factor. And the other one goes directly via adrenaline. But it takes 1 to 2 days before the adrenaline has any effect on the contractile behavior of these fibroblasts or smooth muscle-like contractile cells in fascia. So that was a basic finding for me, that we try to differentiate between acute stress and then just Feldenkrais, relaxation, massage, mental fantasies can help. But if the fascia is tight, you need to get into their autonomic nervous system. And it's also good to use your hand to loosen up some of the contractures in terms of tissue remodeling, in which not only the distance between two collagen fibers has temporarily shortened, but in which they have become stiffer. And then they live in a very tight jacket. So you want to change the mentality of the autonomic nervous system aspect of the person living in the tight jacket, but also it's very nice to help them get rid of the tight jacket that they have fabricated in the last 6 months while living in a very dysfunctional family or work environment. So that has helped me when I work with clients, that I use my hands, I use foam rollers, I give them stretches to loosen the tight jacket. But I also work with them with heart rate variability, breathing techniques, with meditation techniques, with my voice, with their voice, that they also wire down the engine of the fight and flight sympathetic nervous system that may still drive them up 3/4 of the night as if they are living on a battlefield.
Really interesting to me to hear about the delay, the 2 days delay maybe after some period of stress. And that matches so closely what we see and hear from clients with maybe fibromyalgia or chronic fatigue, where if they have a sudden experience of stress or they exert themselves physically, it's a couple of days later where they suddenly feel exhausted or the pain comes on. So this autonomic, I heard someone the other day sort of talk about autonomic rehabilitation, and I really like that phrase.
I've never heard the term. Thank you. That's nice. Yeah.
Thinking about ways, so you've mentioned heart rate variability, so ways that we can soothe our nervous system. I was struck by some of the research you shared at the Anatomy Trains webinar earlier this year about modulating sound input, so auditory input, and how that affects people's perception of stiffness and pain. Maybe you could explain a little bit about that, and then also can you see any links between that type of research and interventions, maybe sound therapy or chanting or singing or just listening to music, how that might help someone with their nervous system?
Yeah, so that was a very stimulating new research being conducted in a group of Lorimer Mosley, where they examined whether people with low back pain are more sensitive to mechanical pressure or whether it's more related to something else. And so they put certain pressures on their lower back and asked them, how strong is that? And they found out, yes, they are more hypersensitive. So if you push them with 0.5 kilogram, they say it's 5 kilograms. And normal people would be more accurate. But then they didn't change the pressure. They made a sound, a squeaking sound that the brain associated with a sense of alarm and protection. And if you then push the lower back, these low back pain patients overestimated. They said this is 20 kilograms. Normal people would also do that, but the low back pain patients even more. And if you came with a soothing sound that gives them a sensation that you are in a safe environment, they didn't have this over-exaggerated sensitivity. So that suggests when you work as a body therapist with people, and after 20 minutes, because or associated with your rolfing strokes, they feel less pain. It may be not because of the work with your fingers, it may be because your sound, when you talk with the client, has changed. So when I work as a rolfer with my hands, with my elbow, I say, okay, this is a little bit stiffer here, let me work there. So I have a normal male masculine German voice. But then because of the melting I feel, after 2 minutes, I go, wow, there we go. Ooh. And then it may have been my voice that got them out of the pain cycle and not the half an hour of work I did before with my elbow. So in my 20, 30 years of roughing practice, I've probably accompanied hundreds of people for sure getting rid of low back pain. And I used to think that is because of my talented fingers and elbows. But now this new research makes me think maybe it had nothing to do with the stiffness of the fascia and the melting touch of my elbow. It may have been the voice. So this long exhale gets the listener, but also the one who makes the long vocalized exhale, into a state of I'm in safety. And when you are in safety, all these mechanoreceptors change their setting very much. So I think we should be much more aware, not only of what we do with our hands, but also how we breathe when we are with a client, how I'm talking, how short the syllables are, or whether I talk like this. And this may have a bigger influence than I used to think in the past.
Fascinating. And the idea that we are co-regulating together with the patient or the client. So it's a kind of continual loop of regulation. And it maybe makes sense why, you know, I sometimes feel better after working with someone, because we're soothing each other as we go. That fits. I don't know if you've heard of the work of Stephen Porges and the polyvagal theory. So his idea that we've got this social regulation system with facial expressions, tone of voice, it kind of fits nicely with that idea. If we can move on now to how people can self-regulate themselves better and use what, you know, it's great to go for therapy with someone else, but sometimes we can help ourselves. I enjoyed hearing that you like cold showers and swimming in cold water, breathing and yoga. What have you learned? What you've learned professionally, has that influenced the way that you carry out these day-to-day practices by yourself at all?
Let me start with the humming and the sound and the breathing. Not for 20 years, but for 10 years, I was a over enthusiastic, just like I'm doing research now, enlightenment seeker. So I was in India, followed several white bearded gurus, and with clenched teeth, I was trying to become enlightened, no matter what. And of course I failed, but on this path, I have learned a lot of things, and I've been doing many hundreds, thousands of hours of breathing meditations on my attempt to get enlightened in this lifetime. And then I discarded that path, more or less. Also, it felt good, but with my scientific critical mind, it didn't make so much sense to sit and recite mantras that I got from a white-bearded guru. But now I'm coming back, and I put some of the white-bearded guru pictures up in my flat, because I'm quite thankful to them. And research in interoception has shown, and also we are doing our part of it, if you are doing humming, so if you do a long exhale, of course, that changes your whole autonomic nervous system. There is probably no single change that is more potent than changing your breathing style into a relaxed breathing at which the exhalation is slightly longer than the inhalation. And there is a lot of research showing that. And so if you do the humming, that means you're not only emphasize and you have very good biofeedback on how soft and how long, but also how relaxed your exhale is. But also, they found out recently you produce more nitric oxide. So a lot of the nitric oxide is produced in the nasal cavities that solves the a big question that people had, what is the function of the nasal cavities? Because they didn't have a function. So I learned in school, it is to save weight in the skull. You don't need bone there, so you make empty space. But now they found out it's a major site of nitric oxide, which is a gaseous transmitter, and it widens our blood vessels. So what Viagra only does to one piece of the body, nitric oxide is doing to the whole body. And this is largely beneficial to have more nitric oxide available. And we experimented with nitric oxide in fascia, and we showed it also reverses the fascial stiffness. So if you're doing humming, you produce up to 15 times more nitric oxide compared with regular breathing. So now I'm experimenting again with different sounds. And of course, if you do the M sound, then you have the nasal cavities even more involved. If you have the R sound, you get more feedback from your chest. And if you do the oo sound, you have more feedback and widening from the belly area. And if you do the aum, like I used to do, you have all three of them together. So I'm rediscovering that some of my bearded gurus were actually much smarter than I used to think at that time. And I find it very exciting. So that much for the breathing and the humming. But of course, I have to be careful which client I suggest with a smile whether they want to chant in the evening. But singing an evening song to yourself before you go to bed or to your children is much better than all these smartphone devices that I'm using. So I'm having an HRV trainer with an app, etc. But just relaxed chanting would be more powerful. But of course, you cannot give that to every client, only if they are available.
I really like what you said there. We can become our own biofeedback device with enough attention and turning our attention inwards and thinking about or tracking the changes that occur. It's great to have this technology, but maybe the technology is kind of a starting point, and then the idea of the technology should be to get us off the technology and to develop that biofeedback and that's regulation ourselves. So you may have answered this partly already. I saw a YouTube video with you and Tom Myers from Anatomy Trains explaining that interoceptive signals from our organs can override proprioceptive signals. Is that what you indicating when you talked about this different temporal relationship between the sympathetic fascia innervation versus the proprioceptive, or the motor system? And so and if that is what you're talking about, can we talk about what that means for our everyday actions? So, if we're doing something stressful, if we're just trying to consciously correct our posture with kind of motor coordination, is there a struggle that's set up between the autonomic nervous system and our kind of conscious, deliberate control?
Well, maybe I can relate back to Bud Craig, who is kind of one of the pioneers in interoception research. And he suggested that our sense of self, which is a philosophical, very interesting concept, that I feel as Robert rather than as 50 robots fighting with each other. So on a good day, I feel like I'm one person, of course, with different aspects. And that sense of self, also, I'm not dreaming, I'm alive. I'm participating in a miracle called life, but I'm participating as Robert. So that sense of self is more nurtured by interoceptive regulation than by proprioceptive regulation. And that makes a lot of sense. So when I do a Feldenkrais lesson or an Iyengar yoga lesson where I focus, where is your shoulder in space? how much weight do you have on your left foot? Is your right knee more bent than the left knee? I stimulate the proprioception. And when they leave a lesson like that, they feel their body more clearly. But when you do a lesson where you stimulate their interoception, which leg they feel more alive, their temperature regulation, their heart beating, then they feel like they are a different person almost. So I think also if you ask somebody, how are you doing? You ask about their state or their whether they have a good day or a bad day. They wouldn't say, I'm more expanded today or I'm more kyphotic today. You don't ask for posture. You ask for their felt sense, for interoception. And that's usually 90% of the answers. So when you ask a friend that you haven't seen for a few days, how is your day and how are you doing? So then they say, oh, today is a difficult day, or I feel tired, or I feel very inspired. I feel torn into pieces, or I feel very together and very quiet today. So that sense of inner bubbliness, of inner quietness, is more related to interoception. And for most people, this is a deeper experience than just the experience that they feel that their shoulder is a little bit further down than it used to be in the last few days. So in terms of how much it means for the client, if their interoception is changed, I think it does override in most examples proprioception, but it depends on the position. So the research has shown that there are some pathologies where proprioception is disturbed. For example, that's the case with chronic low back pain, also with whiplash, and then you should focus on proprioception. But there are many conditions, usually the psychosomatic or psychiatry conditions like post-traumatic stress disorder is associated to interoception, an impairment there, not a proprioception. And also anxiety and depression. If you do a proprioception online course with them, they may not benefit very much from it. But if you do an interoceptive course with them, with somebody who has anxiety, depression, or post-traumatic stress disorder, and probably also fibromyalgia, then they will feel, wow, something is changing.
Wow. So it's really, there are some nuances around the individual person. And, it's a case of horses for courses, as we say here in the UK. So grateful for everything you've shared. And there's so many amazing insights so far. What are you most curious about with your research? Where do you imagine it heading over the next few years?
At the moment, I've become one of the networkers, or one of the elders. With my 66 years here, I've moved into an elder position in a very nice way, where I'm not only focused on making contributions myself as Robert Schleip. I still like to do that and have my name on a paper, but I take more joy into encouraging young scientists to move into their career, and also linking people who are working on the same topic from very different perspectives. So that's what I have been doing in the last few years. And this has been very rewarding, because in fascial research, we are in a very positive aspect of the research. The last time I got to know a similar field was in chaos theory in the early 80s, when there was a bubbling movement all over the planet and people were collaborating. So there is a kind of a gold digger's excitement when a new field opens up and people exchange information, and there is more things to discover than you have brains involved in getting there. So everybody is collaborating. And sooner or later, it may come to a point, like you have it in science all over, where people are competing with each other. Because you want to be there first and you protect your mental property. But in fascial research, we are luckily still many years away from that, because there's so much to discover. And that's why I have focused a lot of my working attention to connect people And the slogan that we have developed here at our department at the Technical University in Munich is, if you want to understand fascia as a networking organ, it works very well if you become a good networker yourself. So I have shifted from being a Robert Schleip single hero with a flag in my hand by being a shepherd for many other people and making them collaborate. And that has been very rewarding for me.
Brilliant. Yes, so there's a phrase, isn't there? As above, so below. And maybe it's with fascia, it's as within, so without, in terms of networking.
But I haven't answered what the little thing is that I want to do.
Oh, yes. What do you want to do?
So we have been focusing in fascial fitness on elastic bouncing movement. They are not new. The Swedish gymnasts used to do them because they felt good and they looked good, but they have been neglected in health-oriented movement compared with muscle strength exercises, with cardiovascular training, etc. And now we are getting swinging, hopping movement back into the health industry because we found out with modern ultrasound that when you do hopping, swinging movements, it's not very efficient in terms of building up muscle strength, but it works on the fascial architecture. So your fascia becomes more elastic. So that's what we have shown. And of course, you are reinventing the wheel that already existed, but you have now new areas to look at because you know the focus is on fascia, not so much on the cardiovascular endurance or on the muscle strength. But an interesting fact is when you get old people to do bouncing again, not only the fascia changes, but their mentality changes. So they become like a child again. They develop humor. So it's almost impossible to go in a geriatric home and make them do hopping movement without them laughing and making jokes, even depressive patients. So this is something I want to find out. We know that other movements change brain chemistry. So we know if you do strength training, you can build up more growth hormone and more testosterone, depending on how you work out. We know that belly dances gets more estrogen going and your fertility rises. We know African dancing gets more dopamine. But I want to find out what happens with these bouncing, joyful, childlike movements, whether it gets more noradrenaline, whether it gets serotonin higher, but it does something so people feel more light-hearted, but they also feel more in danger to take risks. So if you do hopping exercises, people become more childish, childlike, less depressive, but you have to watch out as a teacher because if you have 30 guys there, 1 out of 30 will cause himself a strain injury. Because, yeah, so being childlike in your mentality can also in certain circumstances be not so good. But I'm quite sure that it changes not only your fascia if you do that long term, but short term, it also changes something in your emotional system. And I want to find out how and why. So we are planning a study where we take saliva before the jumping, after, and compare it with regular exercises.
Wow, so you think the effect will be that quick that it can be picked up in saliva? That's really interesting.
So it depends, but testosterone or cortisol you can measure there. Yeah.
So to test testosterone is released that quickly, is it, with sort of weight training or in the saliva very quickly? Oh, I didn't realize that. Maybe cortisol I was aware, but not testosterone. That's really interesting.
And the other is the temperature regulation I was sharing there. So Professor Menze informed us that the biggest innervation type in fascia are the sympathetic nerve endings. So they are by far the richest type. But the majority of the sympathetic nerve endings has to do with temperature regulation. So that seems to be a major function. So whether you open your small microcirculatory blood vessels or whether you close them has to do whether you want to open towards the environment or you want to pull your blood away from the external environment. And so we know cold showers can influence that. It's almost like slow breathing. It has a long-term effect on your autonomic nervous system to get you more vagal, parasympathetically tuned. And I've been doing the Wim Hof inspired cold showers, but also cold winter swimming. And for me, it's a very unique experience. So since half a year, I've been doing that, and now I'm doing it in the winter. Here, I jump into the ice creek here in Munich, which is like 1.5 degrees Celsius at this time. And I do that with my bathers. And I have a 10-minute swim I do it with it. And of course, it's very much adrenaline oriented. But for hours afterwards, I feel I'm alive. And it has really, and you sleep much deeper at night. So I'm now addicted to this winter swimming for me. But it's very nice to study me, not only my physical sensations, how I feel my heart beating. I'm more flexible in yoga for hours after the winter swimming I'm doing. Wow. And I come home and I hug my wife just out of that. So that's, yes, oh, Robert, you should do that more often.
Not so that she can warm you up.
Yeah, but that's the only reason.
I agree. I've been doing much more cold water, river dipping. I don't swim so much. It's more just immersion up to the neck this year. And I agree that it has so many benefits. Cold water used to be a nemesis for me. But actually, it's amazing how you can adapt. And going back to that idea of the safety versus threat, training that, training our body that cold isn't something to be terrified of. And as you said, consciously asking or directing attention down to the extremities and shifting, thinking about blood flowing in those directions. It's quite interesting, the biofeedback we can do with visualization and breathing and all of these things. Wonderful. So good. Thank you for that. Is there anything else you want to say? Anything you think might be useful?
Yeah, you reminded me, because I just paid attention to that in the last week, how as a Rolfing practitioner, with the first client in the morning, I usually had the problem that my hands are too cold to touch them. And that is Robert. I know myself, I have cold fingers. So I would heat them up before the first client. But if I would forget it, it was not ideal. Of course, then you touch them on their leg first before you go for their neck. But I wasn't able to influence it mentally. And the same thing I now learned by the winter swimming. So if your hands are really cold, you can heat them up by doing vigorous muscular exercises, but you can also relax and say, I'm touching a cold animal and I want my hands to be warm. So it's kind of as if you are expanding your body into space. And then I can warm up my fingers, similar like we used to, at least I try to do it in my psychology study with what is called autogenic training, where you say, my fingers are warming, my fingers are warming. And it never worked with me. I could repeat the my fingers are warming, my fingers are warming. God damn, it's not working. But now I can do it. So now if I touch a client, and I'm here in the room that I've been practicing Rolfing for 30 years, and I had that every morning, but now I can open my hand, not by muscle exercise, not by mantra reciting, but by connecting with my fascia as almost like a plant animal. And plants, they have times where they close at night, and then they have areas where they open their petals. So I feel like I'm a plant and I'm opening my petals, and then my fingers are getting warmer. So that is kind of a very naive way of regulating the temperature in my hands. And of course, I want to examine that in the future with scientific measurements.
That would be some great research. and it fits with the whole, you know, when we can either be tightened in or opening out in terms of threat and safety. I'm wondering also, when you say that about carpal tunnel, and you know, we think about, you can either work at carpal tunnel syndrome with surgery, or you can help people soothe around the neck, massage, opening up around the neck to then let everything flow down to the arms.
Very nice.
And one step further, doing it with intention, as you say. That, yeah. Thank you for giving up so much time.
Very nice.